To support this argument, we rejoin the Dietrich team, who've just arrived at the Shanghai Pudong Airport. Dietrich, originally trained by the great Texas heart surgeon Dr. Michael DeBakey, recalls the differences between this and another overseas teaching trip he took with DeBakey in the 1960s.
Some people would say, well, why, you guys took a tremendous amount of equipment. We actually, the night before we loaded the plane, we I think, purchased 6 or 8 of these plastic golf bag containers, and we packed everything into that. Some people, I guess probably coming out of the Shanghai airport and loading in, these drivers thought, well, these guys were great golfers. It was not a lot. I can remember the first time that with Dr. DeBakey, we took our team to Milan and then on to Yugoslavia. But we had over 2 tons of equipment. It was a tremendous endeavor. And what that is, that's an example of the evolution of the technology. And that's what makes China so interesting to me personally, that while we need to be at the leading edge of technology and introduce that in China, it's not like big, huge cranes in cardiac surgery and cardiovascular. The technology has moved down to very small devices and the ability to manipulate within the blood vessel. And that's where endovascular is, endovascular and coronary and endovascular and peripheral interventions. And from the standpoint of the ability to impact China, that's a great advantage because it isn't so cumbersome, it ultimately not be so expensive, and it will, in my prediction, be even more effective.
For Western entrepreneurs investing in the Chinese healthcare market, this technological evolution equates to big business. McDonald's company, Advanced Medical China, is one of the leading independent U.S. exporters of endovascular or non-surgical devices.
The Chinese, within healthcare and cardiovascular field in particular, they've got the ability to leapfrog their technology. They can look to the United States as a window to what is working in America and go directly to what is the latest type of technology in training applications and modalities versus continuing along on their traditional Chinese medicine path.
In many areas of China, this new high-tech wave overtaking the nation is pushing many time-honored medical practices of the past by the wayside. Shops like this one specializing in traditional and herbal remedies are becoming harder to find. Across the Huangpu River, the Dietrich team has just checked into the world's tallest hotel, the Shanghai Grand Hyatt. Just an hour after arriving, the visiting Americans meet on the 88th floor with vascular specialist Dr. Zheng Zaiping and his staff to discuss the cases they'll perform in the morning.
Yes, I'm sorry to greet you here by this way.
Somebody operated your carotid?
It's because of the cervical distal protrusion.
Okay, thank you. Is atherosclerosis in China similar to atherosclerosis in Germany and the States?
Now it's increasing dramatically, actually.
All the atherosclerotic patterns.
Almost.
And that's more related to diet than it is to anything else.
Diet, I believe, yeah, because of open policy, because of the Coca-Cola.
McDonald's. This is sort of a absolute shock for me in terms of what I'd expected, anticipated, and what I'm learning and hearing from now our new colleagues. There are dramatic changes that have occurred in this great country of China that I'm not sure we all appreciate back in the United States. And just speaking with these new friends about such things as lifestyle, things in terms of diet, the way people are conscious of health or not conscious of health. It's interesting to me that in a major city like Shanghai, which in itself, to me, was an absolute contradistinction of what I thought I was going to see. A modern city, skyscrapers, buildings architecturally. The airport itself one of the most modern airports, maybe the most modern airport I've ever seen in the world. And that initial, which I will call, I guess, culture shock, that initial change of where our minds were, it's interesting to me that it's not too unlike what we see in the United States. And in many respects, it may be, at this point in time, completely parallel.
But Dietrich's culture shock has merely just begun. This becomes evident early the next morning.
We had seen the most modern city in high-rises, and now for the first time in the morning, we pull up and we get out of the vans, and here comes Dr. Jing. And so he said to me, Dr. Dietrich, it's a few minutes before they're ready in the operating room, so could I take you on a tour of the campus? And, I wasn't exactly sure what that meant. I thought you're probably going to go up and see the intensive care unit or something. But what it turned out to be, this is a very large campus. And it was a beautiful morning. I mean, the sun was out. It was absolutely fantastic. And Dr. Dai said, Dr. Jing, well, show me where the traditional Chinese medicine is practiced. Because he was very interested whether we're going to be doing acupuncture for the patients. And Dr. Jing, he sort of turned and he pointed to an area. We were on kind of a pathway going down. It was a small building, obviously old Chinese building, and he turned to Dr. Dai and he said, well, that's kind of what is left of that traditional medicine. And to both of us, Nelson and I, we looked at the others and said, this is absolutely incredible. It's so different than what it was. Very impressive campus. Very impressive campus. Thank you. Oh, there it says Second Military.
Finally, it was time to attend to the business at hand, demonstrating America's latest technology for treating vascular disease, technology not yet available to most Chinese physicians. Zheng and Dietrich would perform multiple cases this day, all dealing with a condition common in the United States and becoming more so in China, the abdominal aortic aneurysm.
Sam, everything okay?
When Dietrich trained with the DeBakey team in Houston during the 60s, the most common surgical technique for this ailment was in its infancy. Using Dacron grafts created on his wife's sewing machine, DeBakey developed a synthetic tube that his team surgically implanted in bulging aortic vessels, the major artery that carried blood flow from the heart to the legs. This segment of vessel, in its pristine state, is about the size of a garden hose. But in many patients, the abdominal aorta becomes enlarged and weakened. Eventually, the condition worsens, and if left untreated, the aorta ruptures, causing in most cases an almost instantaneous and brutal death. The ailment has taken many prestigious Americans prematurely, including Lucille Ball and George C. Scott. In the late 1980s, an Argentine physician named Dr. Juan Perotti began perfecting a new technique for treating this precarious disorder. It didn't require the extensive surgical incision of the DeBakey procedure. A self-expanding graft loaded on a catheter was threaded into the arterial network through a small exposure in a leg vessel. Using X-ray views, Perotti guided the device into the aneurysm. Once in position, he deployed the device, anchoring it above and below the aneurysm at normal tissue. Once internally affixed, the tube isolated blood flow from the aneurysm, reducing the risk of vessel rupture. The discovery was simply revolutionary. Patient rehabilitation decreased from nearly 1 month to 1 day. After nearly 10 years of cautious and persistent research, the Perotti device, now coined the endoluminal graft, was accepted by the medical community. And at present, nearly every major American medical device company has developed or is investigating their own design.
Let's shoot the aortogram now, please.
Dr. Ted Dietrich, trained as a classical heart surgeon, has taken the lead in this new field called endovascular intervention. He and his colleagues at the Arizona Heart Institute have performed more of these scalpel-less procedures than any other center in the world.
All right, does that look good to everybody?
And today, Dietrich and his team will demonstrate to their Chinese counterparts the latest design, which not only treats the aneurysm, but also provides for secure placement of the graft to the two vessels that lead from the aorta to the legs. As the team prepares for the initial procedure, Dietrich sees, for the first time, a practice that many American physicians would consider outdated.
And I asked the circulating nurse who was in charge of the operating room, I said, where do you scrub? Where's the scrub sink? Thinking there'd be a scrub sink right out. And she said, well, you go down the hall. It was about at least 50 feet down the hall. I walk in here, and what I saw was a room, a very antiquated room, and they had the spigots coming out, brown, and he said, well, where's the scrub brush? And there is a brush, the brush been used for 100 years for sure. There are no bristles in the thing, and that was a scrub. And we did the case. It was very interesting to me because 4, 5, 6 months ago, we had a surgery meeting. We had a presentation about you don't have to go through a 15-minute scrub anymore. You can just put a little alcohol in your hands or whatever it was, and it makes no difference in terms of infection rates. And I guess the question is, did it really make any difference? And maybe since we're changing our patterns here, it did make a difference. But at the time in my mind, I thought, geez, it's a lot different. We're using 18-gauge needle, huh?
But inside the procedural suite, the equipment rivals some of America's greatest medical institutions. Contemporary imaging equipment, which allows for pristine X-ray views of the arterial system, provides physicians with pinpoint analysis of the vascular system's breakdown. In this hospital, at least, the infrastructure for successful endovascular procedures is in place. But contemporary equipment is but a small part of the equation to ensure long-term victory in the battle against cardiovascular disease.
I think our primary responsibility during this trip was to explain to the Chinese doctors how do these devices work, but maybe more importantly, how you select a patient for it. Every device doesn't fit every patient. And as you deviate from that formula, then you have the opportunity or the propensity for failure, because there's always the enthusiasm for the physician to treat all the patients with a new technology, and that will not work.
For the first case this morning, the mission was accomplished. The 60-year-old patient will be discharged tomorrow, bearing a device that grants a new lease on life. While the next patient is prepped for Dietrich's second case of the day, he is challenged by one of Jing's residents to a friendly contest of a game symbolic to fruitful Chinese-American relations.
And I remembered about Richard Nixon and everything, so I said, well, we'd like to play ping pong. And I hadn't played ping pong, in a number of years, and I'm not very good, but, well, I don't want to brag, but we wiped them out. I mean, they were a disaster. I come back into the lounge, and I said, Jing, I said, I compliment you. I said, as endovascular surgeons and specialists, I think your team is excellent, but as ping pong players, you're a disaster. And then I said, well, Dr. Jing, when we made the tour this morning around the campus, I saw those basketball courts. I said, do you fellows play basketball? Oh, we're the best basketball players. So I said, okay, well, let's play basketball. We finish all the operating schedule with basketball.
United States against China in the basketball.
Okay, no problem. Just my thing that we could have the match.
You could have the match?
Yeah.
Basketball?
Yeah.
On the court?
Yeah. When? Maybe...
After the case.
Okay. This afternoon we have the basketball match.
You guys got any shoes? Basketball
Yeah.
shoes?
今下午完了以后我们来打篮球比赛。
Okay? But I need some gym shoes.
No problem. No problem. No problem.